That may be.
Or they're just not getting the airflow enough across the condenser and they might be icing up a little.
Well, I told them the first thing I want to do is to take the covers off, those wooden covers,
Yeah.
and then see how they do then.
Yeah.
Because if that'll solve it, that's the way to go.
Put another one right there. Increase capacity.
All right. Hey, I'm pretty much, there's 5 of us up here, so I'm pretty much set. So I'll call the committee to order, and we'll go to Health and Human Services, Day 2. And as I've said before, if one of the LBA seats are not filled and you need a third person, bring them up. Well, no, I don't think I need them back here, but whenever you're ready.
Good afternoon, Chairman Gray, Senators. My name is Nathan White. I'm the Chief Financial Officer with the Department of Health and Human Services. Today, you will be hearing from the Divisions for Behavioral Health, the Division of Economic Stability, the Division of Long-Term Supports and Services, and the Division for Children, Youth, and Families. And we will do our best to stay to the allotted schedule. And today, Katya Fox will be kicking it off.
Good afternoon. Katya Fox, Director of the Division for Behavioral Health. And hopefully before you, you have our packet and our slide presentation with all the backup documentation that may or may not need to be referred to during this half hour that we have together. So I am going to go straight to page 3, which is the budget highlights. And what I want to note here is the mix of funds that fund our division. And one area that is different than some of the other divisions is the heavy reliance on general funds. And you'll see that as we go throughout the presentation. The other funds are also of note because we're the fiscal agent. We have the Governor's Commission on Alcohol and Other Drugs funding within our division. And then some of the highlights with the federal funding are we have 2 block grants, and we also have our Housing and Urban Development federal grants. On page 4, this is where we start highlighting the differences between the governor's budget and the House budget. And so the Division for Behavioral Health Operations is actually at the division level, which is essentially the director's office. And the one change that was made in this area was that the Choose Love program was eliminated by the House, and that is $250,000 per year. And essentially that funds a position and a part-time position, so a full-time and a part-time. The Bureau of Drug and Alcohol Services. So there were some significant changes made for the Bureau. This is on page 5. And I think you've heard already about the Liquor Commission funding for the Alcohol Fund. And so traditionally, the Liquor Commission contributes 5% of their gross revenues to the Alcohol Fund, which funds the Governor's Commission on Alcohol and Other Drugs. That amount is 5%. It has varied over the years, but has been in statute at 5% and has been fully funded at 5%, which amounts to about $10.7 million in that per year, and that can fluctuate based on liquor revenue. The change that was made was that the funding tied to the liquor sales was severed, and therefore The alcohol fund, the Governor's Commission funding, is now funded by an HB2 provision, which is through the Opioid Abatement Trust Fund and that commission. That means, so the 10.7 will remain the same. However, the funding source changes to the Opioid Abatement Trust Fund. The complications that arise with that is that you're decoupling alcohol sales and the commission's work. And then you also have a funding source that has various restrictions and policy around it based on each of the settlements that the Attorney General's office reached with the drug manufacturers and the others that contributed to the opioid epidemic. And so therefore, there's expectations around those settlements and some parameters around which those funds, how those funds can be used. The Governor's Commission, on the other hand, has a lot of flexibility in the current way that it's funded. And so if you think about the funding sources for our overall substance use system, you think about the state opioid response federal funding that we receive, about $28 million a year. That's very much dictated and that it needs to be used for opioid response. Again, with the opioid settlement dollars and the trust fund for that, the idea is, and the expectation is, and in some cases it's written in those settlements, that those funds are to mitigate opioid situations and the things that happened as a result of the opioid addiction. Governor's Commission funds, again, are very flexible, and therefore what we've been able to do is bring the funding together and braid it in such a way that we're able to fill gaps as they arise. If you have the Governor's Commission now using opioid abatement funds, those restrictions start to apply and we start to have areas that may fall out. So for example, we have the doorway system. We have the 9 doorways that are federally funded through our state opioid response grant. And that funding can't be used for other purposes other than opioid response and opioid treatment and opioid related programs. So the Governor's Commission has allocated funding to the doorways to be able to address all substances and not just opioid response. So this is creating quite a dilemma. And also it takes out $10.7 million out of the system to be able to respond to substance use needs in the state. And that's each year.
Senator Rosenbaum.
Speechless. Thank you, Mr. Chairman. Thanks for taking my question. So, really a couple questions. The way I understand this, by what the House did, basically cut substance use disorder funding programs in half by taking out the 5% of the liquor funds and then backfilling it with opioid abatement funds.
I'm not sure about the percentage on that because what I can say is that $10.7 million will no longer be available through the trust fund if it's now going to be going to the Governor's Commission. So it's $10.7 million.
Follow-up?
So I also, it's my understanding that about half of the programs the Governor's Commission funds are not related to opioids, but are related to alcohol and other substances. And those opioid abatement funds would not be able to be used for those programs. Would we stop doing them, or would the department find other ways to continue to fund alcohol prevention or programs or meth, cocaine.
So I would say that the department's ability to backfill anything right now is at serious peril because of the back of the budget provision in HB2 as it currently stands and as passed by the House. Our flexibility has really diminished, and any reductions that we're going to be facing, as we all expect, over this biennium are going to need to be prioritized, and I'm not sure that we're going to be able to backfill anything. And yes, the Governor's Commission does spend a significant amount of dollars on areas, as I said, to fill gaps that are not to be able to be filled by the trust fund or by the SOAR grant.
Senator Waters?
Thank you, Mr. Chairman. You know, kind of following up on Senator Rosenwald, you know, I do sit on the commission, and I'm very much aware of all the entities that are funded through that are not related to opioid. And I'm particularly concerned about, if you could say some more about the Doorways program. I thought that was one of the great accomplishments of Governor Sununu, and we are now putting those into statute. But that being the one-stop for all means that, as I recall from the statistics, a lot of methamphetamines, of course alcohol, cocaine, other substances that people can go to the Doorways program and get the referrals. Is that the...
Yes, absolutely. And the idea and the support has come from the Governor's Commission is to fill that gap. The Doorways are primarily funded by the State Opioid Response Grant. However, as I said, the Governor's Commission has made significant investments in the Doorways so that they can address all types of addiction and not they can be blind to the substance.
If I may follow up.
Yes, you may.
Then, you know, obviously there's needed to be immense focus on opioids for the last few years, but that, you know, we do recognize that the most fatalities are caused by alcohol and other, I mean, in terms of the scale of health problems. And so not having these funds might affect what we are able to do about alcohol. And I see some funding for the youth programs at a very limited amount, but there's a lot more than that, isn't there, that in terms of the alcohol area?
I would say that based on the current House budget, that there are going to be some tough choices that have to be made about prevention programs and all of our substance use services programs.
Thank you. Thank you, Mr. Chairman.
Additional questions at this time? Back to you.
I will also note that HB2 has a provision in reference to the Opioid Abatement Trust Fund, which requires that certain funding from that trust fund is directed. And so there are funds that are going to the Granite and Northern Shield program. Emergency shelters, the homeless shelters, are also funded out of opioid abatement. And then the troubling provision is that contracts effective May 1st or later are going to be required to be terminated and liquidated to free up the funding to allow the funding to go for the Governor's Commission and for these other purposes. So I know Nathan has been doing some work in looking at what actually is the balance of the trust fund. As you probably know, these aren't all funds that came at once. They're spread over years depending on each settlement with each entity that was sued and settled with the state. And so therefore, we're getting very concerned about the balance. And additional funds will be coming, but at this rate, the balance is hovering around break even.
Sure. Thank you, Katya. Yeah, currently based on the obligations, and when I use the term obligations, it means directives from the Opioid Abatement Commission. Under statute, they direct the department to enter into certain contracts or RFPs. As of today, there's a balance of about $400,000. The provision that Katya was referring to in HB2 would require the department terminate, we're estimating about $20 million in new agreements that we have already entered into or would enter into between now and the beginning of the next state fiscal year. We would terminate those contracts and liquidate the funds in order to have adequate funds to fund the $10.7 million each year in the governor's budget as proposed by the House.
Senator Rosenwald.
So the last time I was on the Opioid Abatement Commission, I went to a meeting, I think we had about $40 million in the fund. But, so I'm surprised to hear that we have a balance of 400,000. I'm wondering, does that include the basically $25 million for the 2 housing projects plus the second round of the second year of the first round of grants plus
Sure. So that number includes the second round of grants. It also includes the $10 million for SGIA for the state grant and aid program for homeless shelters, as well as the $3.5 million in the Department of Safety's budget, as well as a new RFP that accounts for $10 million of that.
did it include the judicial branch's temporary housing program? Which
Yes,
we
it includes
appropriated
every
6.7
single
million.
obligation and vote that has been taken by the trust fund. So
Okay.
everything that you knew at that point in time is in place. And when you take all of that in the commission's most recent governor and council approved contracts as well as votes, the balance remains at 400,000, and that also nets out the amount that's tapped in this budget as proposed by the House. All right, I'm going to speed up a little bit, I hope. So I want to go to the next page, on page 6, and talk about children's behavioral health. There was a significant change in from the governor's budget to the House budget, and the children's residential program was cut by $2 million a year. And that is coupled with an additional reduction in the DCYF contract for children's residential care. And Marie Noonan will be talking about that when she presents a little bit later. So that's a total of $10.8 million over the biennium that's been removed from children's residential services. We're very concerned about that because there are efforts to rely less on residential care, but we can't just automatically have that happen. And we have the need for these services with the children with the highest needs. And our first effort has been about bringing kids closer to home and having them be in our residential programs in the state. And this would undercut our efforts to continue to build out the children's system of care. All right, now the meat of it. So if we go to page 7.
Yeah.
This doesn't mean that children are going to be in residential programs out of state, right? They're just going to be, who knows?
So without this funding, we would be having to find funding elsewhere. We need this funding for our children's residential programs, period. And so there's always going to be a need for reliance on children's residential services for, as I said, the children with the highest complex needs. We are making every effort to have children remain in their communities, but that's over a period of time and can't just happen because of a budget reduction.
Thank you.
All right, on page 7, we have the Bureau of Mental Health Services. This is where we have experienced the deepest reduction from the governor's proposed budget to the House proposal. And so this reduces the amount of general funds that are available for mental health services by close to $19 million a year. Those funds are used for maintenance of effort for our block grant funds, but more importantly, they're used to support people in our communities on a daily basis. We have provided for you within your packet a supplemental document that says Community Mental Health Program account, because this is the account that was reduced by $19 million. And it includes all of the potential impacts of such a deep reduction on our programs. So we have the graphic on the front, but then attached to that is every single contract that is funded through that account. And so this is the really the core services in our communities for mental health. So it is our entire crisis system. So our rapid response access points, our
Would you hold that up so the senators can know
Oh,
what they're
sure.
looking for? Okay, but yours is in color.
yeah, mine's not in color. Everybody, okay. And so you can go through and see, but these are essentially our crisis system supports, including mobile crisis. It's our community mental health center contracts that we have with them to provide a number of services that are not covered by Medicaid. It is for transitional housing. Every single bit of housing that we have invested in, you have invested in over the last 6 years is in this account. And so we have been able to have supportive housing help hundreds and hundreds of people across the state. And the reduction would make us have to make really difficult choices about which one of these services or how many of these services would need to be reduced, if not eliminated. I know that yesterday there was discussion about the Philbrook building and the sale of that. And the building is probably the least of our concerns. The $1.9 million a year to support the services that happen in that building are much more important. And regardless of where the facility is, that funding is used to support those individuals who need that level of care and who benefit from that program. And I've been rehearsing this for 6 weeks or however long it's been, and so I have a lot more to say, but I'll pause there to see if there are any questions.
Senator Rosen?
So I have two concerns about these cuts. One is I'm concerned that by cutting community mental health services will be in violation of the 2014 Amanda D. settlement. But I'm also concerned that by not treating people in the community before they reach crisis, we're going to start to see ER boarding going up again. And we've been doing a really good job getting people out of the ER and into an involuntary bed. But I'm worried that if we can't get to people before they're in a full-blown crisis, we're going to see the ER numbers go back up.
Agreed, and it would significantly impact all of the work that's been done to achieve many of the components of the 10-year mental health plan, the Mission Zero effort, as well as the Community Mental Health Agreement. But when I sit back and I look at all of that, I think more importantly of my neighbor who needs to have a mobile crisis response because their child is experiencing a mental health crisis. So I think about the impact on the community and how are we going to be able to address their needs should such a deep reduction be made.
Back to you.
All right. The last one is homeless services. We were fortunate enough to receive some additional funding in the last session to increase the bed rate. If you recall, there was a one-time investment of those funds so that we went for homeless shelters. We were able to raise their rates from about $20 a day to $27 a day. And the governor included and the House maintained that $27 would remain for the upcoming biennium. But of course, of note, the opioid trust fund is helping support that with the tapping of that through the governor's budget as well as the House budget. And then I know that there's been discussion about the Waypoint Young Adult Shelter, and there's a footnote to make sure that those funds are directed to continue to support that program.
Senator Rosenwald.
So when I read the House Bill 2 provision about homelessness being funded by the Opioid Abatement Trust, I thought it said $5 million a year, not
Yes.
2.5.
Right,
What am I missing?
I'm sorry. What I said is it helps support it. It's not a dollar for dollar, and it's not assumed that way. It helps support the homeless shelters at all, not just the rate increase. So it's 2.5 a year.
Sure. So as Katya was indicating, there was a piece of legislation this past session that appropriated $2.5 million of general funds for the current year, and that supported the rates. During the governor's phase of the budget, there in HB2, I believe this is what you're referring to, Senator Rosenwald, and correct me if I'm wrong, are you referring to the $5 million each year from the opioid? Yeah. So a portion of the SGI grants were funded with some of the opioid dollars at $5 million each year.
Can I follow?
Yes, ma'am.
So are we talking about $7.5 million a year for homelessness, or $5 million a year, but some of it's from the opioid trust fund?
So the shelters are not fully supported by opioid abatement, a portion thereof, and we calculated it based on how many people who are using those shelter services have some nexus with opioid use and risk. So it was a percentage therefore so that we could make sure that we adhered to the intended use of the trust fund funds.
I'm still confused. Because House Bill 2 says $5 million a year from opioid abatement.
Well, maybe after the
So
meeting today,
Kevin
tomorrow,
can
we
figure it out.
You can contact them.
We can provide a follow-up that shows the SGA contracts and how those are funded. And what you'll see is a portion of opioid funds and a portion of general funds supporting those contracts as well, some for the SGIA dollars. And we can send that along so you can see the funding mix.
Back to
And
you.
I think that concludes. I just want to reiterate that although I'm representing the Division for Behavioral Health, there are other parts of the department that have a significant impact on the people that we serve, including the Medicaid budget and the DCYF budget. So, and happy to follow up at any point in time that you have questions.
Yes, ma'am. And guys, you don't need the jackets. Don't need the jackets. They can be put on the back of the chair, they can be put on something else. You don't need the jackets.
Nathan took you up on that one.
And if Mr. Kane says anything about the jackets, you have him come get me, okay? All right.
You never knew what power you had, Mr. Chairman.
I told them I had their back. Whenever you're ready.
Good afternoon, Chairman and Senators. Thank you very much. My name is Karen Hebert. I'm the Director for the Division of Economic Stability, and I'm here to present to you about the division and some of the changes made. These are essentially, I'm just going to dive right to slide 2. These are human service programs in this particular division that assist in both individuals and families with what I refer to as their financial health. We have assistance programs for that are permanent for some individuals and some that are temporary. So these are cash assistance programs. It also includes child support, food security assistance, and child care. The temporary assistance that we offer services for essentially are designed to help people become more self-sufficient. It includes work programs to reduce barriers, learn new skills, and ultimately gain employment. On slide 3, the overview of this particular budget. This is essentially what I refer to as the human service side of the house, which is these are programs where human service is essentially dependent on personnel. Personnel account for about 35% of this particular budget. And essentially, we have the experience of people who receive services from us expect to talk with people providing those services and the people who can help them. They expect people to be accessible to them and who are qualified to help them with their particular needs. People want to talk with other people and not just a phone recorded system. There are some who want to self-serve, but even then they still need a person to be able to talk to when there are complications or they have questions that need immediate attention. There are multiple programs in this division for assistance and other types of direct services. And these programs, approximately 56% of the funding is federal. And the general fund portions for some of these programs account for the state's maintenance of effort for Medicaid and TANF.
Senator Birdsall has a question.
Thank you, and thank you for taking my question. Have you heard any rumblings about, since this is 56% of the federally funded, have you heard any rumblings about the feds taking any of that away?
I have not.
Okay, good, thank you.
Yep. So moving to slide 4, I'm going to zero right in on really essentially what our greatest challenges are. Bureau of Family Assistance and Field Operations. These are essentially the staff who make the determinations of whether or not someone is eligible for any of the assistance programs, including all of the Medicaid programs, TANF, which is Temporary Assistance for Needy Families, the SNAP program, which is Supplemental Nutrition Assistance Program, as well as Child Care Assistance. These are services delivered in all of our field offices across the state. There are 11 of those offices. And they rely on our IT case management system that is our integrated eligibility and enrollment system known as New Heights, as well as a document imaging system. We don't work with paper. Basically, all the paper we receive, we scan it for imaging, and the images are what is processed for people. So the summary of changes for this particular bureau and its accounting units, we have one prioritized need that I want to emphasize here today, which is essentially for a Tier 1 response call center, which ultimately helps our staff gain greater capacity in order to meet the demand and process the volume of activities they need to process. There are also a significant change for this particular bureau relates to the governor's budget and the House, who unfunded 70 positions in this particular bureau. And again, these are positions that are relate to eligibility determinations. So on slide 5, essentially gives you a high-level overview of the work that this particular bureau does for people who need assistance. There are about 204,000 individuals who receive services through our bureau. There are about 21,000 applications received and processed each month. We receive about 30,000 incoming phone calls through the current Tier 1 call center now. So the 30,000 inbound calls does not include those received in the district offices individually. There are about 129,000 documents processed monthly by staff in this bureau. So the department is experiencing some great challenges to service delivery, and we have concerns about our abilities in both the short and long term due to staffing issues. There are 285 positions that work to help determine the eligibility of these programs. With 69 of them being unfunded through the governor and House budget, it's 24% of the eligibility staff. We already have a vacancy rate of 22.5%. We have attrition rate of about 10%. And of the positions that are filled currently, 27% of those positions are in training and not even able to make determinations at this time. We're facing a number of policy changes that we're expecting, primarily from Medicaid, but also several from SNAP, as well as TANF. For example, effective July 1st, there is a specific Medicaid policy change going into effect that's going to increase the workload of staff in this bureau by about 36,000 cases a year. You may be familiar with Senate Bill 134, and essentially the staffing that is needed for all of the requirements outlined if we were to pursue the current statute as it's written. Staffing that would be needed for that that have been noted in the fiscal note for that bill, which relates to work requirements and the tedious processing of multiple verifications that would be needed based on the language in the current statute that I think is really complex for people when we tried it back in 2019. So I feel like we could probably do better moving forward if we were to implement work requirements that could reduce the staffing needs in that area. You may also be familiar with Senate Bill 131, which calls for provisional eligibility of Medicaid, specifically for nursing facility care. And this essentially is because nursing facilities are dependent on timely determinations of Medicaid. So the nursing facilities essentially are strained and are carrying the cost of care for a number of residents who are waiting for Medicaid determinations, but it's taking too long to process. There is an extraordinary volume of manual processing done throughout the field for long-term care, but also for all applications and processing of documents. We are doing a lot of different work in strategic planning to try to address the capacity, to make increases in capacity wherever we possibly can. It includes system changes, applying different business models, shifting the organizational structure. There are a number of things that we are trying, but while we're doing that, essentially the need by having a call center to help us with the capacity and address the issues to keep the engines moving things forward as best as we can and as efficiently as we can is essentially what I'm asking for support for. In the next slide, slide 6, essentially without funding these positions or without the funding to continue a call center, We're looking at how capacity is going to be adversely impacted. Our wait times for inbound phone calls are going to increase, probably 1 to 2 hours, which is really awful for people. We will have higher call abandonment rates. We will see complaints that will increase from constituents, and I've heard from many of you about a number of complaints from people who come to you. Those are going to increase if we're not able to manage the capacity. We will experience processing backlogs and delays in determinations. And if we don't have a call center, I essentially need to take about 7% of staff to answer those calls every month. It's time taken away from processing applications and issuing determinations that ultimately could result in adverse outcomes for people. Not having the call center also creates a risk of financial penalties due to the increase in SNAP errors. Sorry.
No problem. I was just waiting for you to finish a little bit. Senator Rosenwald has a question.
Thank you, Mr. Chair. How quickly could you stand up a call center? I see that you're looking for appropriations in both years. But is that first year realistic?
We have a call center in place now, which the contract for it expires June 30th.
Ah, okay.
We would like to continue it.
But they can't do 988 at the same time.
Well, can I follow up?
Yes, ma'am. we
Is
can
this
follow up.
something that ServiceLink could take over?
Using ServiceLink essentially is part of our strategic approach to increasing our capacity because they can work with clients a little bit more directly and for some folks more easily. They provide that service on the ground, if you will, for people. So we want to be able to work with those programs to help us help the applicants and clients who are receiving services. We see them playing a much bigger role in that. So we want to address the risk of paying for any financial penalties or capitation payments for Medicaid for those who truly are no longer eligible for Medicaid or the issuance of other benefits. We want to address and decrease the risk of delays in verifications that are made or for paying for individuals who no longer reside in New Hampshire. And confirmation of that essentially comes after the fact. We'd like to prevent that from happening in the first place. So while we're taking every action we possibly can to increase the capacity in this bureau, we really need the support of the call center to be able to maintain some management of the workload that we have right now. I can move on to the next.
Additional questions at this time? Go ahead.
Thank you. So slide 7, this is with respect to the Bureau of Child Development, which also includes what's known as Head Start Collaboration. So this is the bureau that administers what's known as the Child Care and Development Fund. It's a federal fund, also referred to as CCDF, that is used, that's about $28 million that the state receives each fiscal year, used to support primarily families with a child care subsidy to help them access child care so that they can work. We also use some of that funding to support child care providers, strengthening the quality of child care in the state with activities such as professional development opportunities, technical assistance, and we also pay them incentive funds to support some of the quality activities that they do. In HB2, on the significant changes noted in this slide, HB2 of the 24-25 budget directed the department to include in its request a budget, or in its budget, $15 million, so $7.5 million per fiscal year, to pay child care providers for things that would improve recruitment and retention efforts, like bonuses, paid time off, flexible spending accounts. So we asked for that in this particular budget, and it was not funded by the governor or House budgets. But we learned that the House added an organizational note directing the department to use TANF funding to support this particular purpose. And TANF funding is actually not, the supporting childcare business is not an allowable use of TANF. So this is not an option to be able to fund the childcare workforce.
Oh, Senator Rosenberg.
Thank you. So can TANF funds only be used for the scholarship program, or what other allowable uses are there for TANF funds?
Sure, thank you for the question. So the budget includes the maximum allowable amount to transfer from TANF into CCDF. And the majority of that fund is for the Child Care Scholarship Program to meet the increased utilization of the program. But there is a regulation that essentially states that the CCDF fund, 12% of it must be spent on quality activities. So that's where we use the funding specifically to support professional development and other quality incentives to the provider community to help them improve, make those quality improvements. So the purposes of TANF, there are 4 purposes under the federal law and regulation. One of them is the first one, to provide assistance to needy families so that children can be cared for in their own homes or in the homes of relatives. The second purpose of TANF is to end the dependence of needy parents and on government benefits by promoting job preparation, work, and marriage. The third purpose of TANF is to prevent and reduce the incidence of out-of-wedlock pregnancies and establish an annual numerical goals to prevent and reduce the incidence of these pregnancies. The fourth and final purpose of TANF is to encourage the formation and maintenance of 2-parent families. The other changes in this particular bureau relate to HB2 sections, Section 110, that essentially provides the department with the authority to request further general funds to avoid a child care wait list, and also the authority to utilize TANF funds for child care scholarship. On slide 8, there are 2 accounting units within this particular bureau, and we had submitted a change request during the House. This is what this summarizes, essentially moving funds from the quality child care accounting unit into the child care scholarship portion of that different accounting unit, essentially to meet the very rapid increase in the child care utilization that we've experienced over the last several months. Since January of 24, utilization has increased 56%, and our whole focus has really been on ensuring that we avoid a wait list. So we've been trying to make the right changes and decisions so that we fully optimize the federal CCDF funding to meet the needs of families and so that they can access affordable child care. The next slide relates to the Bureau of Child Support Services, and really the significant change here essentially was unfunding 9 positions in this particular bureau. I will note that 3 of them are child support officers, and I think it's important to know that the cost of a child support officer, essentially, child support officers can collect 6 times their cost in child support for families. So it makes a good return on investment for families. And the child support essentially assists in both cost recovery for folks who are receiving TANF and also cost avoidance so that families are not using public assistance if they're receiving child support. The next slide refers to the Bureau of Employment Supports. And again, the only change here really was the unfunding of 2 positions. This program supports the work program, New Hampshire Employment Program for TANF recipients, and supports an employment and training program specifically for SNAP recipients. The very last slide essentially relates to also the Bureau of Family Assistance, what I refer to as the business and policy side of the house. This Bureau administers all of the business and policy administration over state and federal financial assistance programs, including SNAP, TANF, and multiple state supplemental programs such as APTD. There was 1 position that was unfunded in this bureau. That's it.
Questions from senators? They seem to be either mesmerized or happy, so I'm not quite sure.
Might be both.
Might be both.
Well, I don't know.
Thank you.
Okay, thank you. Oh,
Jeez. Yeah.
you're waiting too long.
Thought you got away.
Our TANF caseloads have been declining for some time. I'm not sure why, but I guess that's good news, but does that make it less onerous that these 2 positions were unfunded?
For the Bureau of Employment Supports.
Yeah.
So the Bureau of Employment Supports, their participation rate is what they're focusing on for people. So not everyone participates in the program. We're trying to solicit more people who are able to work into that program and making sure that they are accountable to it, so that if they're able to work, that we are helping them get to work. So the decline in TANF, I think, has been a steady but very slow decline over the years. So I'm not expecting that to have any impact on the New Hampshire Employment Program. But I think that as we see changes that go up and down with the utilization of TANF, that in some of the impacts that can influence that trend relate to the economy. If it's a pretty good economy in the state, for example, fewer people need the assistance temporarily. So when the economy doesn't fan so well, then we find more people apply for and receive TANF. So we want to make sure that we are serving all of those individuals. Mm-hmm.
All right, we'll try it again.
Thank
Before anyone gets a chance to ask you any more questions.
I don't know what to do. We're ahead of schedule, you know. It's going. Maybe it's the temperature in the room that's.
It's a little warm in here, but that's okay. Thank you for having us today, Chairman Gray and Senators. My name is Melissa Hardy. I'm the Division Director for Long-Term Supports and Services. I have the privilege of overseeing 3 distinct bureaus: the Bureau of Adult and Aging Services, the Bureau of Developmental Services, and the Bureau of Family-Centered Services. On slide 3, just a quick little picture of the cycle and the areas in which we touch, children from birth and through aging. So we have the privilege to provide services throughout the lifespan for people in our department, which is an honor for us. So I just wanted to show that. We provide home and community-based services, meals, congregate housing, family support, adult protection. So we run the gamut in our division. Jumping to page 4, looking at our overview of the budget, you can see that we've consistently been around 1/3 funded by general funds. So we're looking at 33% for the fiscal year 26 governor's budget, recommended budget, and the House recommended budget. We have multiple funding streams within our division, mostly diverse in the Bureau of Adult and Aging Services, where we have funding through the Title III Older Americans Act. We have nutrition funding through the Nutrition Incentive Program. We have social service block grant funding, or Title 20 funding. That also impacts our Bureau of Family Centered Services. We have nursing facility quality assessments. We have some funding through the Individuals with Disabilities Education Act. We have a maternal child block grant. And then, of course, Medicaid FMAP for our waiver services. So a braiding of multiple funding streams, whether it's state or federal or county funding. Slide 5 talks about specifically the Bureau of Adult and Aging Services, and looking at the summary of the significant changes since the governor to the House budget. We have an increase of the county cap to 3%, where previously in the last biennium there was not an increase to the county cap, and that is year over year for the next biennium only. It does on...
All of the senators understand the county cap? How? Why don't you give them a little bit of background?
Sure. So in the aging side of our division, so for Choices for Independence program and nursing facility funding, the county pays approximately 90% of the state match for those Medicaid funds. Excuse me. So the counties, historically, if you look at the BDS side, we have a 50-50 match with the federal government and the state. So the counties take on a lot of the burden of the funding for aging services that include nursing facility funding.
Senator Waters.
So what will be the impact on the counties in terms of cost?
Sure. So in the compare report that you have in front of you, if it's on page 1,173, in the governor's recommended budget, she had increased the county cap by 2% over the current year. The county cap was frozen in the current biennium at the state fiscal year 23 rates. While there is a 3% increase each year, there is also a provision that increases the credit to the counties by $5.6 million. So the overall net effect is a slight reduction in 26 and a slight increase in 27 to the total county contributions once you take into account the $10.6 million total credit each year with the 3% increase to the county cap.
Thank you.
And Nathan just referenced our next bullet here with the increased credit to the counties. That was due to increased FMAP during the pandemic that will be paid out over the next 4 years to the counties at $5.625 million a year.
That's because of the federal money coming back that wasn't shared with the counties during that period.
Correct. And then the last significant change for the Bureau of Adult and Aging Services, suspends the congregate housing program. The congregate housing program was put into HB2 of the last biennium. It funded $750,000 of general funds for two housing authorities, which really provides gap services for people to stay in the community, out of the ERs, out of higher levels of care. However, it was not funded. We did ask for it as a prioritized need, but it was not funded. So, a little bit of a concern on how, the people that these two agencies serve will be able to stay at a lower cost than having to go into an assisted living or a nursing facility.
Senator Birdsall has a question.
Thank you, Mr. Chair. Thank you for taking my question. Was that ARPA funds that funded that, or was it general?
It was general funds.
Thank you.
I believe it was a request put in by our previous Dean of the Senate.
Yes.
Oh,
I'm
I think that it might have been. So,
pretty sure.
Yes.
the individuals who are in congregate housing, if they end up in assisted living, should we expect that they'll also end up on Medicaid?
I think it's tough to answer, but I would say that that's a high probability of that. However, we have very few number of beds in New Hampshire for assisted living that take Medicaid as a payment. So those beds are pretty scarce as far as Medicaid individuals being able to live in assisted living.
She's thinking. Follow up?
I'm just wondering what's going to happen to these elderly, low-income folks. If,
As I remember, the history is that the only 2 years that this has been funded were the previous 2 years. The previous year and the year we're in now.
It was suspended, I don't know for how long, and then funded in the
right,
last.
we used to do it, we suspended it for a while, then the previous dean of the center.
And last year there was a lot more money, or last budget there was a lot more money than. Senator Birdsall, you had a question.
So how, since the last biennium it was funded, how many people went into the congregate housing versus prior?
Sure. So they didn't have it prior because there was no funding.
So it went from 0 to,
0 to 40. Oh, I have my number here. 44. So they've Laconia has served an unduplicated count of people of 36 individuals. And the Manchester Housing Authority has 9 people and 2 people on a wait list waiting for services. And those services include things like meals, housekeeping, laundry, transportation, all of those services that keep people more independent in the community. On slide 6, just an area for consideration again. Senator D'Alessandro, I think, was part of this, getting this into HB2 last biennium as well, funding the foster grandparent care program. It has since been unfunded. We are looking to, instead of repeal it, suspend it in case our finances look better and it's a program that we could reinstate. So we're looking for that change instead of repealing, to suspend it.
If you make that amendment in my name.
Thank you. Any questions for adult and aging services before I move to developmental services?
Go for it.
Okay. So the Bureau of Developmental Services, we had 2 significant changes. The first one I'm going to discuss is reducing the developmental disabilities services and implementing a wait list. So the department put in a prioritized need for developmental services waiver for wait list, which was funded by the governor in her budget of about $63 million. In the House phase of the budget, $63 million was taken out of the budget, essentially leaving us with our waitlist unfunded. There is a footnote that we can seek additional funds through fiscal committee if we determine that there will be additional funds needed to serve this population. But we do anticipate this decrease in funding starting a wait list for funding for our people on our developmental disabilities waivers.
Senator Rosenbaum.
Thank you. I have a couple of questions, but guess I should note that I was just looking over my notes from the governor's budget address, in which she said there will be no DD wait list. So I think maybe House Finance forgot, but, or weren't there. When we take someone off, when we start someone on the waiver, we don't necessarily provide them with all the services they're approved for. But the minute they get some service, they're counted as not being on the wait list. So given that we know it's been hard for people to hire personal care service providers, in addition to creating a wait list, won't this cut just mean that people who are being served will find it harder to access the services that they're approved for?
Thank you for the question. I think when you look at our reports from Health and Human Services Oversight, we report out on barriers as to why people who are currently funded can't access those services that they are funded for. So that can range from anything from not having a provider, like you said, or not having Medicaid up and running yet. So I do anticipate that we would have to operationalize how we would rank anyone that, their service needs as far as, what they must have in order to stay independent in the community versus some of the nicer to haves that we provide on the waiver. So we're going to have to work with our area agencies and look at what services people really need in order to stay in the community and rank those as far as who gets funded.
Yes, ma'am.
Maybe it's a question for the LBA. Those funds didn't lapse, right? But there was $80 million that was removed or lapsed, or?
That $80 million. Oh, I'm sorry. So the $80 million reflects the amounts that are in the accounts that are expected to be in the account going forward that you can use for this purpose, right, Nathan?
So this is a fun one.
Oh, God.
Well, I'm just going to preface it with that. So
Be like county cap.
I think by fun, he means complicated.
that is correct. So RSA 171A establishes 3 dedicated accounts for DD services, in-home supports, and acquired brain disorders. And those accounts were established, I think it was Chapter 346 from 2019, where they established them for the first time so that no funds would lapse that were appropriated for those services. And immediately thereafter, we had COVID. And all the services that could have been delivered did not occur, and we accrued a balance. And the balance in the governor's phase was addressed by including footnotes within each of those accounts, and a reduction was made of $80 million total funds to $7,100 in order to account for those. So it's a little bit backwards in the sense that you're actually seeing a reduction in the total appropriation in the budget, but it's reflected, the $80 million is actually reflected in the footnote. So in order to lower the total general fund need in the budget, the carry forward funds were applied. So that the governor's budget and the footnotes there would ensure that those carry forward funds would be utilized in balancing this year's budget.
Okay, thank you.
Continue.
And that was the next bullet here on slide 7, as far as utilizing the carry forward to decrease general funds. So that was what Nathan explained so eloquently. And then slide 8 is developmental services areas for consideration. We're asking for the extension of our developmental disabilities pilot program to be extended through the next biennium to allow for the remaining 5 individuals who are being serviced by this funding to remain on until they age out. And they will all age out of the service by the end of, by mid-27. So we're just asking for that funding to be continued through this next 2 years.
I don't see a cost associated with that on the bullet.
We're already appropriated $2.8 million from 2022, I believe,
So
that
it's
we've,
non-lapsing and continually appropriated and all that good stuff.
So in Chapter 79, Laws of 2023, the pilot program was extended. There's an HB2 provision where that would allow us to continue that appropriation that would otherwise end on June 30th of 2025. By extending that, it will allow the 5 individuals still in the program to age out of it, and we wouldn't have to terminate it early.
Okay, you can do that one too.
So I think, just to clarify though, is this a new request of the Senate? This is something that's already in House Bill 2, and you'd just like the Senate to keep it there?
Okay. I was not sure. I didn't remember it.
The next area I'd like to discuss is room and board. So this is funding that is used for, it's general funds that are used for residential providers to offset the costs of individuals living in residential homes in the community. So currently, we are appropriated about $2.375 million of general funds per year to help providers offset that cost of room and board. We did put in a prioritized need request that was not funded of $5 million a year additional to that $2.3 million to continue to support our providers in the community so people can stay living in the community. Currently, we have about 240, I'll call them beds in the community that are funded by room and board dollars, and 306 beds that are not currently funded by room and board dollars. What we're hearing from our providers is that without this additional funding, they'll be at risk or actually close some of their programs due to the rising cost of, maintaining a home in New Hampshire. So Medicaid does not cover any room and board funds for people living in the community. So we did ask for that appropriation. Lastly, for the Bureau of Developmental Services, we have recreation and socialization services. So we were able to get an appropriation in 25 through Senate Bill 409 for recreational services for individuals who have developmental disabilities. We were awarded $500,000 in general funds. We did ask for that as a prioritized need in this biennium. I am happy to say that we did spend all of those funds already, so there is no lapse for that money to carry forward. There was, I think, I don't know if it was in HB2, but there was a piece of legislation that wanted us to lapse those dollars to continue, but there are no more dollars; they're all spent. Also, there was a part that wanted us to have a designated fund as far as kind of like a charitable organization to pay for these services, and we just don't think that the department is the right place to place an organization like that. So we do, support recreational activities, but don't think the department should be fundraising for that. Any questions on developmental disabilities? On my last slide, slide 9 talks about the Bureau of Family Centered Services. And again, just an area of consideration. Nothing has changed from the different budgets here, but we did ask for a prioritized need of $1 million in '26 and $1 million in '27 for early supports and services for children who are uninsured or underinsured. So we're seeing a trend where kids do not have or are not eligible for Medicaid, but need intervention services early for either developmental delays, physical therapy, speech therapy. So that was our ask for the Bureau of Family Centered Services.
Questions? Yes, no?
Thank you very much.
Great. Division of Children, Youth, and Families. Might as well go on, and because we are considerably ahead of time.
Fish and game.
I need somebody, so if you could contact one of the other aides, how long do you think you're gonna be?
No more than 45 minutes?
Okay? Yeah, ask them if they can be here an hour earlier.
Can I ask a question? Sitting around here.
Yes, Senator, you may ask two
Why was
questions.
the clock moved?
The clock was
I know.
moved because sitting here, it was a glare on the clock and you couldn't read it.
I
No, I
couldn't.
can't see it.
But now,
Hurts my neck.
half of us,
Maybe what we're gonna have to do is have two clocks.
two clocks. I was looking for it yesterday, or this morning, in energy.
Yeah. From back here, you could not see it. There was a glare from the light, and we will try to make it better for you, Senator. Yeah, it's much nicer than the one that was there, so.
You do.
And part of that request came from the day I forgot to put my watch on. And so I was depending on my phone. All right, so back to you.
Good afternoon, Senator Gray and members of the committee. My name is Marie Noonan. I'm the Division Director for the Division for Children, Youth, and Families, and thank you for your time this afternoon. I'm going to move right into slide 2, which provides an overview of the work of DCYF, which includes not only child protection, but juvenile justice in terms of delinquent children and children in need of services, as well as the Sununu Youth Services Center, which is the secure treatment center for youth. For the past 6 years, substantial transformation of our child welfare system has taken place. We've brought in new services and have changed the way we serve child protection and juvenile justice, children and families more preventatively outside the formal child welfare system. We've done this through our system of care work through the Division for Behavioral Health Services, specifically the Bureau for Children's Behavioral Health. We've done this through voluntary, community-based voluntary services in child protection, community navigator programming for families that come to the attention of our central intake unit but do not need the formal system, and also through our juvenile justice assessment and diversion programming. We're at a critical point right now where the efforts that we're on course to strengthen are our services and supports when families do need the formal child welfare system. We need to ensure that families have an array of services available to meet their needs, and we need to make sure that caseworkers have those supports and services at their ready to offer the families in need. Moving on to slide 3, there's a graph of child protection and juvenile justice, youth, and out-of-home care. And what this trend is currently showing, which is promising practice, is that we're seeing a decrease in youth in out-of-home care. The pink trend line is to date in 2025, and this number will certainly ebb and flow, but we're seeing positive trends, and that's a promising practice that we're seeing from DCYF's perspective. Moving to slide 4. This is a budget overview for DCYF. You'll see that we are largely funded through general funds. However, we're a large division, heavy on personnel, heavy on services for children, youth, and families. We're a client-facing division, and we provide protection and services to vulnerable children and families, and we are the deepest end of the system. 2 primary focal points of my presentation will be services and workforce, both of which are the drivers in ensuring that we can meet and impact positive outcomes for kids and families. The first bullet on slide 4 is just that. It's our operational need of having an array of quality services to show continued decreases in out-of-home care and increased outcomes for kids and families. Our unfunded workforce impacts have a significant impact on DCYF being able to provide the services that families need. And it impacts the retention of other staff because we simply can't turn families away. So when we have decreases in our workforce, it means other workforce members need to take on more. The final bullet is an overview of the numbers of children and youth we've served in calendar year 2024. We served 31,776 unique children and youth, and that breaks down to about 70% of those youth in child protective services and about 30% in juvenile justice services. Moving on to page 5. This is an overview specifically of our child protection activity, which is 4210. This is largely our Child Protection Bureau and all the services that we provide. You'll note on this slide that we have about 526 full-time authorized positions in the right side of the slide. 15 of those have been unfunded. In particular, I want to highlight that 4 of those are CPSWs, 3 of those are case aides, and 4 are administrative support positions. So the case aid and the administrative support, those are both positions that support the functions of the child protection worker. So 7 support positions affecting our CPSWs. Additionally, we have an attorney that was unfunded, 2 business system analysts, and in particular, those 2 are both from our data and quality assurance unit, which is a very small team of about having 6 staff being able to run our full agency's data and quality assurance programming, so that's a significant impact. And then there's 1 program specialist who works directly in our risk and safety consultation program, which is secondary oversight to our most vulnerable investigations, our most vulnerable children that are coming to our attention for investigation.
I have a question.
I'm sorry. Absolutely. Thank you.
The child advocate talked about doing cases and investigations, and it appeared to me that there could be a duplication of effort in some of those things. I'd like to get you to comment.
Sure. So DCYF is tasked with investigating child abuse and neglect, as well as providing services for abuse and neglected children, as well as those that come into our attention for delinquency and CHINs. What the Office of Child Advocate does is they provide additional layer of oversight, and they may be contacted to review work. So the office frequently reaches out to DCYF to talk about the casework that we're doing. And often we work collaboratively, talking back and forth about the work that we're doing to oversee the cases and children that come to our attention.
What I heard, internal, is that it is duplicative, but you're not upset. You can think about that. Senator Birdsall has a question.
Thank you. Thank you for taking my question. Those 15 positions, are they they're unfunded. Are they currently filled or are they open positions?
We have several of them that are currently filled, and so we'll need to figure out a way to make that adjustment. So they were filled at a point when, right as they became unfunded.
Oh, okay.
And I was at the end of Marie's presentation, just globally for the department, one of the things that we were hoping to do was to submit some technical change requests that have no general fund impact. This is an example of that because the positions were unfunded at a point in time, and some of those are currently funded. Other positions are vacant that are funded. So we just like to clean some of that up, and I can certainly submit that if the committee's open to it to the LBA for consideration.
Thank you. Yep.
And I'll try that question phrased differently, okay? With the child advocate per the House budget going away, what impact is that going to have on your investigative services?
We will continue to provide investigative services and open case services in the traditional way that we do each and every day.
Okay, what I just heard was it won't affect me.
We are always open to wanting to do a better job, and so we're always open to that type of feedback, but certainly our work will go on per usual.
Senator Birdsall has a question.
Well, so is it the case that the Office of Child Advocate actually gets the first phone calls, looks into it, and then forwards them to you? Is that how it works?
No.
Okay.
So if there's a concern for abuse, neglect, a caller or a reporter, as we call them, would call our central intake unit for concern for abuse, neglect. That's what generates an investigation by our agency.
Could you walk
Yeah.
Could you walk through a case where, not a particular case, but in a case where you would get the call and then the Office of Child Advocate would help? How does that flow?
Sure. So DCYF would be involved with a family either through an investigation or an open case. The office would receive a call from someone who is asking for their help or assistance, and the office would review our electronic case management system. I hear from them that sometimes they receive all the information they need from review of our system, and on other occasions they'll reach out to the local office managing or a supervisor, sometimes myself, but we'll reach out to seek additional information, may want to meet to discuss our action.
Sorry, Marissa Henn, Deputy Commissioner. I just want to add a little bit. I agree with everything that that Marie Noonan just said. I think one of the things that's important to emphasize, and the governor herself has commented on this, is the ways in which these are complementary roles. So one of the ways that we work collaboratively with the child advocate is that she is in our facilities, meeting with youth, being another voice for they and their friends, they and their families to come to as a source of guidance. An example that commonly comes up for us we talked about Hampstead Hospital yesterday, is families who are going through that very difficult challenge of how to navigate the mental health system. So to have someone they can go to help explain, to help navigate, to help connect them with community and advocacy resources, and to work with us to share what they're learning and the opportunities for continuous improvement really is a complementary role. In addition to the oversight and the feedback mechanisms that Director Noonan talked about. So I just want to emphasize again, it's complementary. It's not just one of sort of watchdog, watchy. It is about helping families get information and advocacy from lots of different sources.
Okay. Deb, at some point, I'd like to get the child advocate and the director in my office together.
Thank you.
Senator.
Thank you, Mr. Chairman. Thanks. So I'm thinking in particular of these two kids who were in Tennessee at a facility where they were being abused. And wasn't it the child advocate that investigated and brought them back and not DCYF? So you guys were busy doing your regular other work, but the child advocate went and brought these two kids back from an abusive placement?
It was the recommendation of the child advocate that we bring those children back from Tennessee. That's correct.
Thank you.
Moving on.
On the, also on slide 5, under the summary of significant changes, I wanted to point out, you may be familiar with House Bill 1588, which expanded the capacity for DCYF cases to go from age 21 to 22 if the children or youth are receiving special education services. And so DCYF did receive $3 million in funding via the Educational Trust Fund to help us align with RSA 186C in the education law for that extended jurisdiction. So we will be able to serve those additional children and youth or young adults at that point up to age 22. On the bottom of slide 5, Senate Bill 463 expanded access to counsel in child protection cases for children in residential treatment and in other cases as requested. And so the governor did suspend implementation of Senate Bill 463. The House removed that suspension and established 3 DCYF attorney positions and directed the department to fund the positions from other funds. So we did not receive funding for the 3 DCYF attorneys that we would need to be able to implement Senate Bill 463. There's also been a little bit of confusion, I think, from my observation about these 3 attorneys. Some might think they're attorneys to be able to provide the counsel for the children. These are, in fact, DCYF requested attorney positions in order to implement this new statute. Additionally, worth mentioning is that where the governor had suspended the implementation date, but the House removed that suspension, we will need to work, depending which way we go, if we go with the governor's suspended date or the House removed suspension date, in order to stagger rollout, depending on which of those decisions happen. So depending on the decision, there may be some implementation dates that need to be realigned.
What year is Senate Bill 463?
I'm sorry?
What year?
That was in 2024. Moving on to slide 6. The graph on slide 6 depicts the residential treatment contracts funding. And you'll see in the first bullet that, and you heard earlier from Katya Fox, Director for the Division for Behavioral Health Services, that we did receive a reduction of funding for children's residential treatment over the biennium, specifically $6.8 million for DCYF and $4 million for the Children's Behavioral Health. And we believe these put children with the highest needs at risk. So the most complex and unique children's needs result in looking for residential treatment as an episode of treatment, and not having a robust array of residential treatment options available is of concern to us. Specifically, DCYF and Bureau for Children's Behavioral Health are focused on a reduction in residential treatment. It's in DCYF's strategic priorities. We're making lots of efforts to do that. My ultimate concern is that we can't force the system change before the system is ready to absorb the change. And so we have a lot of work to do to build out our foster care system, to build up use of kinship care, which are all showing promising practices. Specifically, when it comes to foster care, we're at a disadvantage of families willing to take children aged 14 to 18. We have a very robust recruitment plan in place specifically for that age group. So we're stepping up that recruitment. DCYF is currently in the process of gearing up to review every single child's case in residential treatment to make sure if that child can step down, that we look to do so. We ensure that we have the services available to support them in the community so that we have that continuum of care. We're also looking to increase our community services through one of our contracted providers that has shown very promising work with families. So overall, my concern would be changing the funding for residential treatment before the system is ready to absorb that.
And one One thing that I'd also just like to highlight, in table one above, what we tried to do there is demonstrate comprehensively the total funds that are budgeted for residential treatment. They're budgeted in 3 separate locations across the department. And that's partly due to the funding sources as well as history. But you'll notice in state fiscal year 26, we do have quite a bit less general funds in that first year. We are asking for some of the funds to be added back. I recognize the difficult budget times, but at the very least, if that is not achievable, we would like to potentially request that some of those general funds from 27 be moved into 26, so that if they were not spent, those accounts that they're budgeted in carry forward the money. That way, in the first year, if there was a large increase, we would at least have money available to meet that need. And if there wasn't, then it'd be carried forward in the second year, because one of the challenges here is we can't necessarily predict the specific needs of each child. So if a child qualifies for Medicaid, we can leverage Medicaid. If they qualify for TANF or 4E, we can leverage that. If they don't, then it's 100% general funds, and that makes budgeting particularly challenging when it comes to this specific need. But I just wanted to express that at the very least, we would like to potentially right-size the general funds from year to year in order to accommodate some of those challenges.
The second bullet on slide 6 references Senate Bill 417, which was a bill which became law to enhance oversight of children and youth in residential treatment. This was 2024 legislation, and it created 12 new positions, and it established new criteria for out-of-home placement and enhanced oversight by DCYF in court. And so we did receive funding for 8 CPSWs and 2 juvenile probation and parole officers. Those were funded in the House and the budget. What was not funded but was requested was 2 additional DCYF attorney positions to absorb the additional court oversight and hearings that will take place as a result of this important legislation. And you may remember some hallmarks of this legislation included on-site tours of all areas where kids have access to, meetings while CPSWs and JPPOs are on-site monthly at programs, meetings with leadership, direct care staff, as well as the clinical director or the child or youth therapist, or conducting those kinds of visits or meetings in real-time virtual time if we can't align meeting with them while we're visiting the program. And then there's the additional court oversight required with this legislation. Slide 7 provides a depiction of all of the out-of-home care options, all of which DCYF needs access to. And residential treatment remains a critical option for high-need youth while we right-size programming to reduce reliance on that level of care. Episodes of treatment will always be an important and necessary component as part of our service array. We want to bring kids closer to home. We want kids to be able to stay in their communities, and having access to this level of care is as important as all the other kinds of care in the array that we offer. On slide 8, the top bullet talks about some of the community-based out-of-home care options that I did just discuss briefly on the prior slide. And in particular, general foster care rate increase was requested and not funded in the governor's or the House budget. And so for kids requiring out-of-home care, while kinship care or care with relatives or people known to them is the first and best option, the second best option is having them be in community-based care in a family home setting. And foster care is a necessary service to be able to provide that level of care when kinship is not available or not an option. Wanting to ensure that we can offer foster families a level of daily rate that pay for their daily care that aligns with the cost of care to raise a child is something that we would like to be able to offer to ensure that we have foster families able, willing, and available to step up to meet this need. the sub-bullet, the second bullet in community-based out-of-home care is enhanced foster care. This is a new rate, and it was funded in both the governor's and the House budget. And I just want to add that this is a new rate available for kids that might otherwise be in residential treatment. So it's an enhanced rate. It allows a foster family to be able to provide full-time care, staying at home, not working out of the home. We know lots of times kids, they may be suspended from school. They have lots of therapeutic and clinical appointments. They might have special medical services or care that's required of them. And I'm talking about the kids with the highest unique needs that often end up in residential treatment. And so we're very pleased to have enhanced foster care funded in the governor's and House budget to serve not only as a way to avoid residential treatment, but as a step-down option as well, and show that a child or youth could best be served in the community. So these are meant to be very short-term, 60-day placements in order to launch a child or youth into another community-based setting after being able to demonstrate some clinically appropriate community-based care and connecting with a family. The second area is our transportation rates. The rate increase that we requested was funded in the governor's and House budget. Without transportation, this is a place where child protection and juvenile justice staff need to transport kids to visits, to appointments they have, to recreational activities. We already had our transportation provider say they can't do Saturdays and holidays. They can't do after hours on-call work as a result of their current rate. So again, we're pleased with the rate increase for our transportation provider. Our licensed alcohol and drug abuse counselor contract is the third area here, and the House eliminated the funding for this contract. This is a really critical service for youth and families who are experiencing substance use impacts. In particular, slide 9 is a depiction of the kinds of services that this MLADAC contract provides. We would be at a significant disadvantage if we weren't able to offer this service. In particular, this service offers drug testing, assessment and evaluation, short and long-term counseling, adolescent services, connection to services, and community-based service wait lists are often bypassed as a result of being able to offer this service in-house through a contract. Additionally, our MLADACs in each of our district offices, they're co-located. They provide about 15 to 20 hours a week of consultation and training to DCYF staff, and uniquely available through this contract is their ability to accompany our staff out at a home visit. So if we are going out on an investigation where there's substance use concerns, we're able to bring an MLADAC with us to engage immediately with a family member at their earliest time of interaction with us, often when they're most willing to participate in a service like that as we're knocking on their door. They're also able to help us observe the surroundings that a child is experiencing, looking for signs that our caseworkers may otherwise miss. So there's lots of other information here on this slide regarding our program, but it is of great concern to imagine that we wouldn't have this service co-located with us, and we think that families would be negatively impacted by the long wait lists that they would be facing if having to receive some of this service in the community.
Senator Waters.
Mr. Chairman, could you speak a little bit to the new services for adolescent service expansion? I know it's not been long, but what does that provide? How many people have been involved?
Thank you. Thank you for the question. So we did expand in July of 2024 because there is a shortage of child and youth access to substance abuse treatment in New Hampshire, in our state. And so we expanded the contract so that the contractors can go out, oftentimes with our juvenile justice staff, to be able to meet with, evaluate, assess, and treat youth experiencing substance misuse. And since the contract started July 1st, it has served 183 youth have been referred to the program since that time. And again, it bypasses community wait lists if we can even find a treatment provider available.
Additional questions? Please continue.
Thank you. Moving to slide 10. This is another depiction where I cannot emphasize enough the impact on caseworkers and ultimately family outcomes when these reductions take place. So if we don't have access to foster care, transportation, residential treatment readily available, MLADAC, ultimately the caseworker spends more time looking for these services. These service needs don't go away. The fact that the court orders us to identify these services doesn't go away. It just takes time for the caseworkers away from meeting with other children and families to have to research, provide some of this themselves, and take additional time to be able to search to fill those gaps. On slide 11, this is our juvenile justice activity. In particular, there's nothing significant of change or note here, but I do want to highlight there's one unfunded full-time authorized position, which is an administrative support position for juvenile justice, and it happens to serve 3 offices, so it is a significant gap. It services our Conway, our Littleton, and our Berlin juvenile justice offices. Moving to slide 12, this is our budget for Sununu Youth Services Center. We have 87 classified funded full-time authorized positions. In particular, the House decreased the budget for personnel, overtime, and temporary staffing needs. Also of note, while we don't have unfunded positions in particular, the House gave us a blanket reduction of $300,000 in our personnel costs for fiscal year 26. So we will meet this by holding back the posting of 6 positions. So while none are unfunded in particular, we'll need to hold back 6 positions in order to meet this reduction, and we'll end up falling short of this target in fiscal year 27.
Senator Rosenwald has a question.
I'm always amazed by how much money we spend on the Youth Detention Center with a stable census of about 12 kids. In December it was 9, January it was 12, February it was 15. We're still, the House budget still increases over fiscal year 25 adjusted authorized by $4 million a year. I mean, it's like $1.5 million per child per year. How do we rationalize just throwing more money at this place?
Sure. Thank you for that question. I think it's important to note that our budget for the current biennium was based on a closure budget. And what that did was it really upset our staffing. So out of about 45 youth counselor positions, in 2022, we had 6. We had 6 available youth counselors to try to staff a facility 24/7. What that required us to do was to have overtime, a lot of overtime and overtime incentives to try to entice some of our juvenile justice staff to work there, some other departmental staff to be willing to work there. The next slide depicts a bit of this, but we also have a staffing contract in place to supplement the staffing for SYSC. So today, because of the stability that we've been able to provide, the incentives we've been able to provide, we are in a much better staffing position. However, today we have 17 youth at SYSC. It's a small number, fortunately. A lot of states have much higher numbers of kids in secure treatment. However, they're kids with some of the most dangerous behaviors. They do often require us to separate youth, so it's not as simple as having a boys unit and a girls unit, or separating with that kind of simplicity. There are gang-related activities that require people to be separated. There's court orders because maybe they co-conspired on some of their behaviors or charges out of the facility, and they need to be kept separate. There are kids that experience a mental health crisis and need some time on our crisis stabilization unit. So while there might be 17 children, it requires much more than 17 or 34 staff because we need to spread kids in order to effectively treat them. So I know it appears as though the budget is misaligned with the number of children that we're serving. We're also providing great clinical supports and services there. We've got a kitchen to feed kids 3 meals a day, 365 days a year. We've got a maintenance crew who are constantly cleaning, repairing damage done by the youth in residence there. So we have a full array of services to be able to support these kids 24 hours, 7 days a week.
Follow up?
Thank you. What's the rate of kids being readmitted?
Go ahead.
I don't have that information with me today, but I am happy to provide it. It's something that we're watching closely. We know that we are building a new facility in Hampstead. We know that our goal is for 12 kids not to exceed 18. And so we have a lot of work underway to ensure that we are providing the best programming we can to reduce recidivism, while we have a really robust multidisciplinary team coming together to think also about how to avoid kids going in there. What alternatives can we offer? Are there ways that we could, after hours, for example, educate and help police departments be able to secure other options for kids rather than detaining them at SYSC if something happens after hours? So I want to assure you that we're looking at our recidivism and we're looking at our programming both out of the facility and in to try to ensure only kids that need this level of care are there.
And just to add a little bit more context to the numbers, I believe on the compare report in front of you, it's on page 1016, you'll see that the actual spend was almost $15 million in state fiscal year 24 for the operations. The budgeted amount was 11.6. So when Marie was referring to the closure budget, when the budget was introduced by the governor in 2023, in February of 2023, it was at about $11.6 million. We've had to move $3.5 million over in the prior state fiscal year in order to cover those operating costs. So the adjusted authorized number that you see in state fiscal year 25, that's from a point in time from back in the summer. And that is not reflective of the budget. It's actually slightly higher than the budget, but it's certainly not reflective of the actual projections and the need there. So while there is an increase in the House and in the House's budget over the current biennium wasn't set at the appropriate rate anyway, as we've had to move quite a bit of general funds from other areas in order to cover that shortfall for the safety of the children and the safety of the staff.
Follow up?
There was one fiscal year, and I don't remember if it was last year, but we were sending corrections officers there. Was that the $3.5 million?
So what we were sending was juvenile probation and parole officers from DCYF, so not Department of Corrections staff, but we had our juvenile justice staff who actually case manage. These are their kids that are sent there. So we did offer overtime, and actually we mandated overtime for our juvenile probation and parole officers, while we also opened overtime voluntary opportunities up to the rest of the department. That was at the point where we were at 6, and until we have built up to the staffing level that we're at today.
Okay.
Thank you. And then the final slide here, just again, is kind of a visual depiction that worries me a bit about the instability that any reductions could cause to SYSC. We've come a long way since 2022 when we've had just 6 staff there, and the facility has improved in its programming and its clinical work. We've got additional clinicians on staff. We're at a staffing place that is supports the needs of the facility, and so my concern would be that any reductions would impact that stability moving forward. And I thank you for your time today, and I'm happy to answer any additional questions that you have.
Anything else? Yes, ma'am.
Some years ago, and I bring this up because I see Representative Wallner in the audience. The center had a culinary arts teacher on staff who was making $104,000 a year, I think. And she and I talked about which one of us wanted to go get that job. Do we still have the same number of, do we still have 3 math teachers for 12 to 17 kids and a culinary arts teacher?
We do not, which is a bit regretfully because we've got all the capacity to offer wood shop and automotive shop and culinary, so we do not offer that. We don't even have teachers on site. We do have a contract for tutoring, so we have a tutoring contract where kids are educated through their sending school district. They get the work specifically from their sending school district. We have tutors on site who are able to implement that work for them so that they're getting their typical curriculum. So that's the way the school is working. We do have kitchen staff that offer opportunities for kids at higher levels to be able to engage in kitchen activities, but we don't have a culinary person. We don't have those kinds of extra programs available anymore, nor will we at the new facility, so it makes sense.
It's too bad, it looked like a good job. I was gonna bake and she was gonna teach.
Thank you.
And just to give you a heads up, the meeting I'm requesting with you and the child advocate, I believe that we will have a proposal come forward that will change the House budget. I'm just trying to understand the best way to do that and still retain the services that we need and not have duplication, so.
Absolutely. I look forward to it. Thank you.
I think that's it.
Thanks so much. Appreciate your time.
And look at that, we've actually got 2 minutes early before Fish and Game's supposed to be here, but they are, so. We changed the time and had them come at 3.
Oh,
They're not supposed to be here until 4.
yeah.
I see my friends at OLS. Do you want anything?
Maybe, fill a haddock, you know.
I'll see what I
This Fish and Game is coming
I'll
up.
see what I can come up with. Are they here?
Yeah,
Okay, good.
Fish and Games. Karen, if you'd grab the door.
No, they're still leaving.
I'm encouraging.
How do you get clearer a room?
Well,
Apparently. No one wants.
Well, I think there's several of us that do want to listen to Fish and Game. And we didn't lose the whole crowd. Yes, ma'am.
Good afternoon.
You need a red light.
There we go. Thought we had it. Sorry about
When you got
that.
a red light, you're good.
Good afternoon. I'm Stephanie Simic, the director for New Hampshire Fish and Game. I have with me Kathy Labonte. She's the chief business division manager. I want to thank you all for having us this afternoon, chairman and committee members. It's our pleasure to be here. I don't know if you have a particular place you'd like to start, Chairman, but we thought we might start with your letter.
This is your show.
Okay, excellent. Well, you want to start? You want to start with the letter then?
We did,
Sorry.
we did receive your letter, and it indicates to address the differences between the fiscal year 24 actuals and fiscal year 25 adjusted authorized, and the 26-27, And if it is your pleasure for me to do so, I have highlighted some items within there that you may find of interest. Okay,
Go over.
let's go. So I have the compare House to Governor budget, which I assume is the same one you're looking at. So on page, the first difference we have is on page 951, Resource Data GIS Management. This is our transfers to DOIT. And through the House process, we requested an additional $637,527 to be added to our DOIT budget. The bulk of these funds we requested are to be used to bring our regional offices and our hatcheries current with technology and bring them all on to the state services. And if you wanted to add to that, Director, or is that?
I'm happy to answer any questions about that, but currently not all of our facilities and regional offices are connected to the statewide network, which makes it a little challenging to coordinate and to work together. This will definitely bring them onto that system and allow us to have more efficient process in our work.
Thank you. The next big difference that I saw when I was going through the budget, again for the umpteenth time, is on page 969, the game management account, which is a dedicated account. However, in class 304, research and management, there is a significant difference in that class line, and that is for projected research projects, mostly with the University of New Hampshire. And this certainly would play a role on another topic that we're going to talk about as far as sweeping the dedicated accounts. Then my next one I have is on page.
Just continue.
Okay, the next one
Sometimes these senators are, often
on their own thing?
thing, so,
Okay.
just.
Page 971, the wildlife habitat conservation. If you look at fiscal year 24 actual under land acquisitions and easements, just under $3 million, we had the opportunity to purchase a couple of big parcels of land. And if that opportunity presents itself again during the biennium, we would always go to fiscal committee because that would be a specific federal grant to allow us to be able to do that. But that's why that fiscal year 24 actual is so large. Just thought I'd talk about that. Next, we had a change that on page 974 under Inland Fisheries Management. We had a change. We requested on the next page, 975, a decrease in class 50 part-time personnel. We eliminated 6 part-time hatchery personnel positions and requested 1 full-time class 10 position. It actually benefited the Fish and Game Fund because we could use additional federal funds for this full-time position. Next, on page 978, sale of fish food. This is a very small dedicated account, and the revenues that funded this account came from the vending machines of selling fish food at our hatcheries. So it was requested, I believe, by the House themselves, and we agreed, we were fine with this, that this small account be eliminated and any remaining balance be transferred to the Fish and Game Fund, if there is even a remaining balance at the end of this fiscal year.
And future money would go into that fund also?
Correct. It's a very small amount, yes. Next, we have page 991. Oh, I'm sorry.
That's a
Nope.
big jump.
Yep, let's go one back.
Okay.
We missed a big one here. Sorry. Page 985. This is the most significant impact. This actually happened in the governor's budget from our fiscal year, both 24 and 25. We did have a component of general funds supporting our conservation law enforcement program. That was pulled during the governor's phase and remained pulled during the House phase as well. So the general funds went down to zero. I'm sorry? 985 conservation law enforcement. At the bottom where the income, the revenues, general funds, 24, then 25, we have 1.5 million, and then it's zeroed out for the biennium.
David, excuse me, Senator Waters?
Thank you, Mr. Chairman, sorry. Could you speak to the impact of that?
The impact to this is no operations were cut, so appropriations remained the same. So the default is the Fish and Game Fund. So without including lapses at the end of the biennium, the projected balance in the Fish and Game Fund is a negative $2.5 million.
These funds are used to allow us to have the 4 additional officers that were granted through Governor Sununu's budget. And those 4 officers, we would then need to offset where we could pay their salary through the Fish and Game Fund.
If I may follow up. So,
Follow up?
what has occurred then over the last few years is a depletion of the Fish and Game Fund.
Absolutely.
And now it would go negative, which I didn't anticipate that would happen this year. I thought maybe we had another biennium.
It's going to happen at the end of this current biennium we're trying to budget for, 26 and 27. That is all other things being equal. If we maintain our positions and we fill our current authorized positions, we may have to make some very difficult decisions at the department to ensure that this does not happen.
Thank you.
Senator Pearl?
Welcome, Director.
Thank
Good
you.
to see you both. Were those 4 positions, were they funded by ARPA dollars last time? Is that how
No.
we did it?
ARPA dollars,
to
no
remember.
ARPA dollars were used to fund law enforcement positions.
What
No
did we-
ARPA dollars were used to fund any positions
Okay,
except the.
I thought we did something with ARPA dollars.
The ARPA funding was for the environmental review team.
That's
We
what
had
it
4
was.
positions of environmental
Yeah.
review. Yeah.
I remember there was 4 positions. Now, thank you for
You're welcome.
clarifying that.
If I may follow up too. And could you speak a little bit to the impact of, given what I appreciate Governor Sununu's effort to find funding. But the impact here is also because of the raises in the last budget and.
That is correct.
And the provision for those, continuing those raises was not provided.
That is correct. We were under the assumption it would be provided, and it was only provided as a one lump sum transfer in the last biennium.
And if I may, and what's the amount?
$2 million.
Thank you, Mr. Chairman. A number of departments have convinced the House to raise fees. Do any of your fees go up in the House budget?
Yes, we actually are looking at the wildlife habitat fee, the fishing habitat fee, and the game management fee all increasing. And then also, we will be assessing our license fees as well over the next several months and likely proposing some increases in some of those segments.
And so even with those fee increases, you're looking at a $2+ million deficit?
Well, they're two different things. The budget as it is, we are looking at a $2.5 million deficit. The way that the fee increase has been written is the difference from the fee as it is currently to what has been proposed would be deposited into the unrestricted fish and game fund. I'm not sure if that can actually happen legally, the way that the RSA for those dedicated accounts is written, and that's based on, we'll have to have further discussions on that, which I believe we'll be getting to. So if you take the increase in the fees into consideration, as well as some other language that is proposed in HB2 for gathering, sweeping some dedicated accounts, it would make up that difference. But it's all in how it comes out in the wash, as they say.
Certainly, if there's a concern about legality because of the way that RSA is written, we can change the RSA, okay? The things that cause me concern is fees that are in statute, and so if there's any of those that you have that are in statute, whether some you can do by rules, some you come to fiscal, so again, we may need to talk about that, but Senator Pearl also had a question.
Did you want to respond?
I was just going to say that the inland fisheries habitat fee and the wildlife habitat fee are in statute.
Okay, then we'll need to work either to move those into rules, increase them, or do it a different way.
Sir.
Thank you, Mr. Chair. So you provide, Fish and Game provides some law enforcement services, especially in some of the unincorporated towns, and more in probably the northern half of the state than the southern half. What is your arrangement, or is there any arrangement, say, with Department of Safety for covering those, compensating your department for those times that you cover, perhaps when state police isn't available and you're taking on that role as law enforcement for those communities?
You know the exact on that one?
There is no written agreement. If the colonel were here, he would say that they help each other out.
Right.
Mm-hmm.
It's a mutual understanding. There is no written agreement, and there's no finances exchanged.
Yeah, as far as I'm aware, and I will confirm this and get back to you, Senator, but as far as I'm aware, the only sort of exchange of maybe compensation is directly with local law enforcement, with our agency to them to assist with the OHRV trails and things like that. But otherwise, I'm not aware of any reciprocal compensation or anything like that.
And those are billable hours that you can do with the local communities, if you're covering that?
They actually bill us.
They bill you?
Yes, exactly.
Okay.
That they cover.
That they cover.
Do you, one more if I may? Do you feel that in general, you provide more services covering the state police than they cover back? I know it's reciprocal. I'm trying to get an idea if there's perhaps a shift that needs to occur with some type of compensation.
What I will say is that I know that our staff are highly trained and fully executing every skill set they have learned across the state to the best of their ability. I'm not going to comment on other agencies and what they can provide or can't provide, but I do know that we certainly have supplemented other organizations and offered assistance quite frequently, honestly.
Well, I wasn't necessarily, if I may clarify, but I
Okay,
don't think I asked
sorry.
the question the right way. I wasn't necessarily talking about skill sets. I was talking about time spent. I know you have
Yes.
the dive team and you do a lot of work for
Yes.
some of the agencies as they need that, and when there's unfortunate situations that occur. I guess my question was, do you feel like your agency provides more services out than you receive back in the sense of quantitative value dollar-wise?
I can't answer that.
It-
I would
that's
say,
fair.
I would say my perception is yes, but that's my perception sitting in my seat. I would need to get some details from the colonel, to be honest with you. He is most in tune with that. So if you allow me to follow up with you.
Please do. I mean, what I'm sort of looking for is does there need to be some compensation of your department, perhaps to help with your deficit from another department if you're providing those services?
Sure.
That's, and I mean, I know you all have to work together. I get that.
I fully understand what your
Okay.
perspective
Thank you.
is there. And I will certainly get the information for you.
I appreciate it.
You're welcome.
And I think if you ask the state police, they'd say they provide more, and if you ask
And then-
Fish and Game, they'll say they provide more. So we'll have that standoff.
Understood.
Additional questions from the senators? Okay, continue.
You're going to continue. I have some, I think you're going to cover some things next,
I
so I'll
just
let you
had
go.
one, I just had one more. Yep.
Yeah, okay.
So the last accounting unit in the budget book here is page 991. This is the Glen Cove project, and if you will notice, there is no budget in '27 and a relatively large budget in '26 where the bulk of this work will take place, and then the project will be complete and the federal grants will go away. So I thought I would bring that to your attention as well. So that was my little synopsis of going down through the budget and indicating any changes from fiscal year '24 actuals to '25 authorized and what we have been proposed to '26, '27.
Senator Waters.
Just, thank you. Are you going to go through the other?
The director is, absolutely.
Yeah, okay,
Yep.
fine. And let's see. I just want to see what else is in here. Are you going to talk about the dedicated fund fee?
Yes,
Okay,
Yes,
so
sir.
I'll wait then. Thank you, Mr. Chairman.
Go ahead.
Okay, so we have provided a supplemental document. I think all of you have it now. And there's quite a lot of text on here, but I wanted to provide some background information and then some specific details. Briefly, what I'd like to do is, the first section of this document is HB2, and I'd like to just point out 4 points within HB2 that have brought some concern to myself and our agency. Notably, the first one, of course, is the efforts to centralize the environmental review program into New Hampshire Department of Environmental Services. We understand that this is an initiative of the governor's and want to support that. To be honest, and I've said this before, it is not our preference necessarily that the permitting would be removed from Fish and Game, because it is our purview basically for those species, to protect and conserve those species. Our preference would be that it remained in Fish and Game, but nonetheless, if it is being transferred into the Department of Environmental Services, there are a few things within HB2 where suggestions to RSA 212 have been made, and I provided some language. Our preferences were not necessarily in alignment with all the language that was proposed, and we've suggested some other alternatives to allow Fish and Game to contain the authorities that we have, but then allow for the Department of Environmental Services to undertake the work that the governor has proposed as far as environmental permitting. I won't go through each one unless you specifically want to at this point, but I did want to raise it to your attention, and it's something you may want to consider, and we can meet and discuss if you'd like at a later date.
I do want you to at least hit the highlights.
Okay.
Senator Waters.
Thank you. On that one, so no fiscal impact.
Well, that is one point. 3 positions will be transferring over to DES. And we have requested that 1 position remain with us so that we can at least maintain the continuance of some of the permits that are not DES related. We still have other, I guess, responsibilities associated with environmental review and permitting.
And if I may follow up.
Follow up?
And really the point.
You need to hit the mic button again.
Oh, I keep turn it off because I'm trying to be good and then I forget to turn it on.
Yeah, I try to
I'm
remind
glad you're
you.
watching me. My concern about this had been that the reason we had been doing these things were because of the certain, mandates and agreements related to endangered species and so forth. And that,
Yes, sir.
frankly, the expertise is in Fish and Game, not in DES on this particular area. So that this proposal would at least ensure that you're doing what is supposed to be done on the endangered species. Review, when the alteration of terrain and other things are proposed. Is that what the result of this would be, maintaining?
So the result of this is essentially taking the responsibilities for those specific permits that have a nexus to DES.
Right.
The review would now occur in DES rather than in New Hampshire Fish and Game, which is ultimately requiring them to hire 4 new individuals. They're taking 3 of the positions that we have and hiring a supervisor to then oversee that unit. Cost effectiveness, I don't know that it's going to save us any money. It may cost us more money. They are essentially supposedly hiring equivalents to what we have in our agency, so it's duplication of effort, it's duplication of skill sets. Yes, our concern, of course, is the conservation and protection of those endangered species. And, we're going to try to support DES as much as we can and help them in advance by creating some best management practices, which you can only do for a few species in a few situations. Not every scenario is going to be covered. There still will be consultation with Fish and Game on more advanced impacts to species. DES will still need to come to the species specialists that are within our agency. And to be honest, with that arrangement, we will be working with DES on an MOA to be compensated for the time that is committed, that our staff would have to commit to help facilitate that work. But nonetheless, I'm not sure the proposed language in RSA 212 literally does strike some of the authority of the Fish and Game Agency for this role, and it also illustrates some of the time commitments that are the timeline that was so critical through the whole process, which is not different than the timeline we currently have, to be honest with you. I don't know if that helps you.
Yeah, it does, thank you.
You're welcome.
Because I was a project manager and supervisor of projects, for an awful lot of years.
Yes, sir.
There is a concept called the matrix,
Yes.
organization, where the individuals you need for a particular project remain part of their home district, but come under the supervision of the project. Have you familiar with that concept?
I am, sir, yes. And actually, it was one that the agency Fish and Game has started to begin to facilitate through the ARPA funding and getting those positions into the agency.
Senator Waters, do you think you could take this one on to see if we could make some changes in there using that matrix organization type structure where the employees stayed under Fish and Game, for supervision and training, and we still completed the project, on time for the stuff?
I'd be happy to, Mr. Chairman, if I have the able assistance of Senator Pearl.
You always know where I am.
Thank you, Mr. Chairman. This has been one that, has been an issue of just how we do this and where the positions are and how they're funded for several years. And I think that, the top line is that the top line has been that we're really interested in permitting to be done expeditiously.
Yes.
But to make, and somehow these folks are gonna be paid for whatever department they're in. Mm-hmm. That's important, because we had the funding that the governor had provided, and now
yes.
we're here, we're where we are. But I'd be glad to work and also work with DES to see if we can't come up with something.
When you take a group and move them for a special function, the support that they're getting from their previous, training and other things, and goes away. But if you do this matrix organization, some of that can be retained. So,
thank you.
I do want to see if we can get to somewhere that we can live with and that the governor can live with. So,
Thank you,
all right,
Chairman. I
continue.
appreciate that. Yes, sir. I will ask if you want to, we'll just move on to the next item rather than go into the details of the RSA, because you'll be addressing that, Senator. Okay. So the next item is actually it's 95 in HB2. It's creating the Love New Hampshire Lakes number plate. The concern from Fish and Game is that, and we've seen this in other states, that we are concerned that this may actually reduce the revenue for the moose plate overall. Anytime states usually introduce an additional icon plate, it does affect the other conservation plate. And in this case in particular, the proposal is to use the state-threatened loon as the icon, yet none of the funding is going to be earmarked for conservation of that species or conservation of any wildlife species. It is for cyanobacteria, which I realize and I fully respect is an expensive undertaking. But I also, as a leader of this agency, I look at it as an ecosystem level, and I think, you know, the way you prevent cyanobacteria outbreaks is by having good, healthy ecosystems and using good fish habitat and maintaining healthy water quality and things like that. So it's a variety of things. So I would suggest that you might consider looking at that and whether or not there's an opportunity for us to receive some funding to help support the effort. But nonetheless, we are concerned that it's going to take some funding away from the Moose Plate revenues.
Senator Waters?
Yeah, if I could comment on that. I mean, we do have House Bill 105 in transportation.
Right. Yes.
And I do believe we are trying, if there's something in the budget and if the Senate committee has a House bill, that is probably a better way to go.
Yes.
The other concern I have, Mr. Chairman, on this is that if we go forward with changing the production of the plates, it's going to probably reduce greatly the cost of setup. The reason I went to a decal program several years ago is that we were not convinced in transportation that we had to pass a bill every year, a new plate, and that the cost of the plate, it seemed, often ate up or was more than what actually be produced. And I think in this case, by using the loon, it really creates a problem. So I would hope that we could take this out of the budget, let Senate Transportation deal with it, and then maybe delay it until we have that new equipment and can produce the plates more cheaply anyway. So
I would ask you to have a conversation with safety.
yeah,
They are purchasing new equipment, and because it'll be computer generated, we'll stop stamping plates, we'll stop
it'd be so much cheaper.
heat treatment, we'll stop a lot of things.
Yeah.
So I don't know that the change from one type to another is more than a couple of lines of computer input.
Yeah.
I'm not going to say programming because it's, the way you input it. So again, I'll ask you to do that first
I'll look into that one
before
too.
we try to do anything else on that. I appreciate that.
Thank you. And you are correct, Senator Waters. I did reference the Senate Transportation
Yep.
Committee. That was another reason why I brought it here, is because it seemed that it was already being addressed. So thank you. Item 142 is the next one, and this is essentially allowing Fish and Game Department to conduct raffles, but also it's proposing that we automatically transfer funds in our dedicated accounts that are in excess of $750,000 over to the Fish and Game Fund automatically. I'll be upfront. I actually requested something similar in House Finance. I had requested that the authority be granted to the executive director that when these dedicated accounts had in excess of $750,000, that I had the ability, or the person in this seat had the ability to consider a transfer of funds, but not that it would be automatic. There are often times where we have ongoing projects, and to take the money from, even though it's in excess of $750,000, it will be needed for those projects over the next few bienniums or the next few fiscal years.
Just to comment on that.
Yes, sir.
Because the House is taking so much money from so many different things, one of the people are telling me that because the funds were put in there for a dedicated purpose, to take those funds out and put them to any place else needs to be authorized in the statute or somewhere else. And again, I have not been able to get in. I mean, each one of these funds would probably be different. So just caution you on that. That may take a lot more words than what you think it would take.
Yes.
To make that happen, should we choose to do it that way.
I 100% agree, and that is a concern because they are dedicated accounts. The money was generated for that use, and the point being that at a director's level, working with the staff, you can see where you might have a nexus to that dedicated account and be able to utilize the funds through a different concept through the Fish and Game Fund. 100% agree, but I don't. We're very concerned about the automatic sweep of these funds.
Those ladies and gentlemen in LBA, they help me out tremendously. So,
yes, thank you.
You need to work with them for some more.
Yes, sir.
Thank you, Mr. Chairman. So if if we make that change, does that lead to a potentially bigger deficit in the Fish and Game Fund at the end of the biennium? So you'd have to raise your fees even more?
It would definitely impact it, because right now the way it's proposed is they are using, as far as I know, is that correct? They're using the sweep of these funds to offset the Fish and Game deficit right now as proposed. So certainly we would have to address that, but to be upfront, this sweep would only happen once, because it took years and years for us to even build up these accounts to this level. So once the sweep occurred, I'm not sure that we would see that anytime soon again.
And any money that's going to the general fund now also causes me problems in other places, so.
Right.
We need to make sure that is identified before we vote on anything.
Understood.
Continue.
Okay, so then the next item I had is 182. And this is the item I believe that Senator Waters wanted to discuss. It's about the proposed administrative services 5% fee to all dedicated accounts. This is extremely concerning for us because of the fact that we do receive federal funding, and 20% or slightly higher than 20% of our overall funding is from federal grants. We've created a couple of tables to illustrate. We have several funds that are dedicated accounts that are directly receiving federal funding at the current time. And each of those has a percentage of federal funding in it. Typically, our match is generally a 75% federal, 25% state, which is a bargain for us as a state. If we were to be assessed a 5% fee to these dedicated accounts identified with receiving federal funds, we would lose our federal funding nexus. It's considered a diversion of funding, and then we would not be able to receive these federal funds going forward, and likely would have to pay back whatever point in the biennium we are in.
And we've heard complaints from all of the departments that have been in here that are subject to that. LBA, do I know what the total of the sweep is that from all of the accounts, and what I would have to make up somewhere else to do?
I believe we have that in the surplus statement. Just give me 1 minute.
I'll give you 2 minutes because Senator Waters wants to ask a question.
Yeah. Thank you, Mr. Chairman. It may be this figure of 109,000, but the point here was that that was going to go into the Fish and Game Fund, but the loss would be 1.676 million. And I know Senator Pearl had a list of these dedicated funds that we shared that we wanted to have exempted because of particularly this impact. And with a self-funded department, that this particular robbing Peter to pay Paul to get this funding into the Fish and Game Fund, not to the general fund, was going to actually result in this greater loss. So that was the argument for exemption in this area. Did I get that right?
I think you expressed it wonderfully.
Thank you so much. Don't worry about it if it's a hard number to look up. We've got time between now and the next time we meet to get that information out.
So I will add, so as you're looking at this table, the top has a combined potential loss for funds. This includes those that are being diverted from, if this 5% administrative fee goes through, it includes those funds that are being diverted from the accounts that are Fish and Game are federally funded. And then it also includes the potential for our match on our other accounts that we can use. These are state accounts that we can use for our 25% match and still receive federal funding for work. So the total loss overall, or potential loss, I should say, overall is near $2 million. The contribution of the 5%, if you looked at both types of accounts, is a total of $200,000. So to get $200,000 out and lose $2 million, it's very significant in our operation of our success you know, we're not going to be able to do what we're doing if we do this.
So sorry, so just to answer your question, the total for all funds would be 16 million in each year of the biennium.
32 million.
Yes.
That's the total of all of the 5% sweeps across all of the 32 million, yep. Wonderful numbers, huh? All right.
So that's a significant effect for us. The last item I had on my little form or document for you is actually in HB1. I wanted to let you know that the Conservation Land Stewardship Program is being proposed to be moved into New Hampshire Fish and Game. And this action is going to require, in HB1, the transfer of the positions associated with that program and the funding associated with that program. Currently, that program is allocated, the last table we shared with you, is allocated in the DAS budget, operating budget, but it would need to be moved over to Fish and Game. There is a nexus for this program, and we do have the space for the staff to be able to operate within our organization. So we're supportive of the idea. I've been told they have kind of been left out hanging for a little bit, so we're supportive of it, although we just want to make sure that they come with the associated budget and positions.
Mr. Chair, I have forwarded language. I have forwarded language to the LBA staff to draft this up so that we'd have the ability to work on that if we so choose.
Thank you. All right. Are we at the end?
We are at the end. I would be
All right.
honored to answer any further questions.
Sometimes these people have lots of questions, so, and sometimes they don't have any. Questions?
I think I've asked mine along the way.
Okay. Well, you had the light on, so
Well,
I was ready. No. I would be more of a hunter than a fisher. So I'd be hunting for questions. There you go.
I enjoy those puns.
Since the senators seem to want to engage in levity, then we can do that after we adjourn the meeting. Are there any final questions? Thank you very much. Are there any issues the senator wants to bring up for general information? Okay. Our business today being complete, we are adjourned.
Thank you very much. I really appreciate your time. Yes, sir.
You did.